Bailach níos fearr atá againne. Ceann freastal ar aithne duine, agus tá mé buíocht teachta ó Cuileán a chur an rún seo le héile, agus tá mé fear buíocht go bhfuil an éire bhread chur an seo go míle agat. The emergency consultant in Tala Hospital last week described, this is James Gray, the scale of patients on trolleys in our emergency departments as a disgrace. Many of these patients are elderly, the most vulnerable in our society. It's actually worse than that. I have spoken to families whose sick and elderly members will not go to emergency departments because they know they may be lying on trolleys for days. Figures recently released by the Irish Nurses and Midwives Organisation show that 92,998 people were treated on trolleys in hospitals across this state during 2015. And this is the highest ever number of patients recorded since the Trolley Watch campaign began in 2006 and represents an increase of 21% in hospital overcrowding. It's an indictment of this Fine Gael Labour government. In 2007, Enda Kenny promised to end the scandal of patients in trolleys, and that promise was broken. 4 years later, in Fine Gael's famous or infamous 5-point plan, you promised to create a completely new health system. You promised to end waiting lists, to end apartheid in our health service. You committed to equal access to all, more and better community care, and fewer hospital stays. Shinn Galtanas Ella atá briste. At least in fairness to the Minister, he made it clear that that 5-point plan wasn't worth the paper it was printed on. In the first 5 days of this week, there were 1,395 patients on hospital trolleys and emergency departments across the state. 121 of these were in Our Lady of Lourdes, Drogheda, in my constituency of Louth. On Monday and Tuesday this week, Our Lady of Lourdes had the worst figures, the highest figures in the state. Agus bí go leor den a daoine seo in a sean daoine. And these are an indictment, these trolley waits, the spectacle, the misery of mostly elderly people, but people who are sick on trolleys, is an indictment of this government's health policy. As part of your response to this, Minister, you produced new proposals just before Christmas, and these claim that there should be no more than 70 patients a day on trolleys. You also claim zero tolerance of patients waiting more than 9 hours in trolleys, but on Tuesday there were more than 200 patients on trolleys for longer than 9 hours. And in addition, a third of 300 beds promised last autumn to tackle overcrowding have still not been delivered. Now, in my view, Fine Gael and the Labour Party have no intention of adequately resourcing the health service. Twice in recent months, nurses in the emergency departments have voted for industrial action, and while the strike plan for today, and I welcome this, has been averted, the crisis in our health services continues. Agus tá sé ansal gur scris policy and realtas seo na services slanta tosig. What's happening in the health services is a direct consequence of government policy. There's no other way of looking at this. And it is the responsibility not just of the Health Minister, but for every member of the Cabinet who voted for and who implements these policies. And it's time that the Taoiseach admitted that this government seeks ultimately to privatise our health service. It's time to stand up, and you should take the opportunity during this debate, Minister, to point out clearly that Fine Gael favours a two-tier private health model, and you have alluded to this and highlighted this in various remarks recently. We have put forward this private member's motion in an effort to focus political attention on easing the situation in our emergency departments. We're not all about protesting, we're not all about pointing up the inefficiencies and deficiencies in the government's position. We have positive solutions to these problems. We have published a fully costed, practical health policy. I asked that it be sent to you. I don't know if you had the opportunity to peruse it, but you will see in that there is an ability to realise a world-class, I see you have it before you, a world-class system of universal health care assessed on the basis of need, free at the point of delivery and funded by the progressive taxation. I would ask you not just to read that health document, Minister. I would ask you to implement that health document.
Thank you, Deputy. Deputy Ellis, you have 5